If you have lower back pain and someone told you to strengthen your core, this video could save you months of wasted effort, because sometimes the problem is not that your back is weak. Sometimes your lower back is working too hard because another part of your body is not doing its share of the movement. You may have spent months doing planks, crunches, and hardcore workouts, expecting your pain to disappear, but the pain keeps coming back. Maybe it appears after sitting at your desk. Maybe it shows up during walking, bending, or twisting. Or maybe it arrives at the same time every afternoon, even though you did everything you were told to do. So what is actually happening? Let's look at the system from the inside. Your lower back is not a single muscle. It is a highly coordinated region made of vertebrae, discs, joints, nerves, and layers of stabilizing muscle. Its main job is not to create unlimited movement. Its main job is to provide stability, while your hips, pelvis, rib cage, and mid-back share the movement around it. Think of your lumbar spine as the central support column of a building. A support column does not need to twist dramatically every time the building moves. It needs to remain stable while the surrounding structures absorb and distribute the forces. Your lower back can move, of course, but when it is forced to create too much motion too often under too much load, the tissues around it may become irritated or overprotective. That does not automatically mean your spine is damaged. It may mean the movement is not being distributed efficiently. Here is the first important principle. Your lumbar spine is designed primarily for stability, while your hips and thoracic spine contribute much of the rotation needed for everyday movement. When you twist to reach something, turn your body, or change direction, that motion should be shared across several regions. The hips rotate. The pelvis transfers force. The thoracic spine contributes movement through the rib cage. And the lumbar spine helps connect everything while maintaining control. But if the hips become restricted or the mid-back becomes stiff, the lumbar region may be asked to compensate. This is where problems can begin. Cause number one is the hip flexor system. The iliopsoas and other muscles at the front of the hip connect the pelvis and upper leg to the spine. When these tissues feel shortened or remain active for long periods, especially after hours of sitting, they may influence the position of the pelvis. The pelvis can tilt forward, the lumbar curve can become more pronounced, and the muscles around the lower back may stay active simply to keep you upright. That can create a feeling of tightness, pressure, or fatigue. But tightness does not always mean weakness. Sometimes it is the sensation of a muscle or joint trying to control a position for too long. A simple movement observation is to stand comfortably, gently activate your glutes, and notice whether your pelvis becomes easier to control. If your lower back immediately feels more relaxed, that may suggest that your hips and pelvis deserve attention. But remember, this is not a diagnosis. It is only a movement clue. The practical focus is not to perform more crunches. It is to restore comfortable hip extension, improve glute function, and allow the pelvis to return toward a position where the lumbar spine does not have to compensate constantly. Cause number two is the thoracic spine, or the middle section of your back. Your body needs rotation somewhere. If your thoracic spine does not rotate comfortably, the movement still has to happen when you turn, reach, or swing your arms. The hips may rotate more, the pelvis may shift, and the lumbar spine may receive more of the rotational demand. over one movement that may not be important, but repeated hundreds or thousands of times, the accumulated load can become significant for someone who is already sensitive or irritated. Try placing your hands across your chest and gently rotating your torso. Do your hips move immediately while your chest barely turns? If so, your mid-back may be contributing less movement than you need. Again, this is not a medical diagnosis. It is simply a way to observe how your body shares motion. The solution may include controlled thoracic rotation drills, breathing-based mobility, and gradual exposure to movement. The goal is not to force a huge stretch. The goal is to help the middle back move more comfortably so the lower back does not have to do everything. Cause number 3 is overbracing. You may have been told to brace your core during every exercise, every lift, and every movement. Bracing can be useful. It can increase control when you need to lift, push, pull, or stabilize a heavy load. But maximum tension is not necessary for every moment of the day. If you hold your abdomen rigid from morning until night, your ribs may stay locked down, your breathing may become shallow, and your natural movement may become restricted. That can create a cycle of stiffness and guarding. You feel tension, so you brace harder. You brace harder, so you move less. You move less, so the body becomes even more protective. The better goal is not zero tension. The goal is the right amount of tension for the task. During a heavy lift, you may need strong bracing. During walking, breathing, or gentle movement, you need much less. Try breathing slowly into the lower ribs and abdomen without forcing the stomach outward. If you cannot expand comfortably at all, your trunk may be holding more tension than necessary. Practice breathing, moving, and bracing just enough to maintain control. Your spine does not need to be locked like a machine to be protected. It needs coordination. Cause number 4 is the hamstring system. The hamstrings connect the back of the thigh to the pelvis and lower leg. When they feel tight, they can influence the way the pelvis moves during bending, walking, and reaching. Some people respond by rounding their lower back early. Others lose the natural curve of the lumbar spine and move through the spine instead of sharing the motion with the hips. But here is an important distinction. You cannot determine the cause of back pain simply by touching your toes. A limited toe touch may reflect hamstring flexibility, hip mobility, spinal movement,